Hello, my name's Amy and I'm a clinical psychologist working in the South Wales Renal Psychology Service. Living with a chronic condition such as renal disease not only impacts your physical health, but it can also have a significant impact on your emotional well-being. As renal psychologists, we work with patients to support you to look after your emotional health. In this video, James talks about how he's looked after his emotional health by doing small things regularly, like keeping a daily routine and maintaining connection with people, whether that's with friends or family or other renal patients.
The impact of renal disease and dialysis can be really isolating. It's a long-term hidden disease. People don't know you've got it when they see you, so they don't realise the impact it can have on your life. Yeah, being isolated can really affect your mental health. It's difficult, and because it's a long-term disease, it's not something that is fixed in 6 months, 12 months. It's a long-term, 5 years, 10 years, 20 years of living with this. Can be really draining for your energy as well. Coping with the effects of kidney disease and the effects it has on your mental health is really important to focus on. Things like reaching out to your families and friends. Having that connection to other people is really important, even if it's just a phone call. It doesn't have to be anything extravagant. Just a phone call to a family member, friends, anything like that can really make an impact and improve things for you. I think trying to keep active as much as you can, although we know kidney disease really affects your energy levels, but trying to keep active, keep a routine, make sure you get up, you get washed and dressed, you do your daily activities. Just having that routine can be really important and make a change. Meeting with a renal psychologist has been really interesting and useful. Actually, it's not about a quick fix. It's about having conversations about how you're thinking, and trying just to slowly, nothing radical, nothing extreme, but just slowly change the way you're thinking about the situation that you're in. And I didn't think it would work. I thought it was, just nonsense, to be honest. But after a few months, actually you start realizing that you're thinking differently about a situation, and that surprised me actually, to think this thing's happened to me. I'm thinking about it differently than I would have 6 months ago. So that's really important, and having just somebody to talk to as well, who understands what you're going through, can be really important as well.
Living with renal disease poses a number of physical and emotional challenges that can be difficult to cope with. The renal psychology team specialise in supporting renal patients to make sense of their difficulties and find ways to live with their condition in the best way that they can. Whilst there are general things that you can do to help your overall well-being that we've talked about in this video, speaking with a renal psychologist gives you the space and time to think about things on an individual basis. You can ask to be referred by any member of your renal care team.
For information and resources that you may find helpful regarding your mental health, use your smartphone device's camera to scan this QR code to take you to our resource page. Here you will find more information about support that is available to you.